Today we are going to talk about water medicines. Furosemide, bumetanide, bendraflumethiazide, furosemide also known as Lasix, indapamide. There are some others. This video was inspired by Doris, one of my patients who was on 2 types of water medications, got dehydrated and was admitted with kidney injury. So we are here to tell you about what they are, how do they work, and how to get the best from your water medicines.
And at the end, again, we're going to have some top tips on how to get the best from your medicines from the 2 of us. Stay tuned. So water tablets are a group of drugs we call diuretics, and as Elena was saying in the introduction, there are a variety of different water tablets available, and they're used for multiple conditions, especially if you are prone to water or fluid retention in your body. So they're also used as very effective blood pressure tablets as well. So you could be taking them for blood pressure, heart failure, having just swollen ankles, swollen legs, we call it edema. So there are multiple reasons for using it. The drug itself, or the drugs themselves actually, have some issues in terms of problems that have been caused from using it. And I think we're going to kind of discuss that in a second. So I don't know whether you want to kind of come in here in terms of talking a little bit about more the practical aspects that you see from day to day within your population.
Understanding the practical aspects of diuretics is particularly important in the older population, my patients. The reason being is that the older person is more vulnerable to the side effects of these medications, and the side effects are excessive blood pressure lowering, and which can result in lightheadedness and falls, and kidney injury, because these are diuretics. They drain the water out of your body, and if you happen to go through a bad patch with maybe a little bit of a sickness, diarrhea, vomiting sickness, or you were just going through a spell of really hot weather during the summer, then taking a water medicine will make you particularly vulnerable, lower your blood pressure too much, make you lightheaded, cause kidney injury, and all of that can be to an extent that you might get so unwell purely because of your water medicine that you might need to come to hospital to get treated.
Yeah, and we call these sick day rules, which a lot of you may or may not be aware of. And you can see this information from certain internet websites like Know Your Kidneys, Think Kidneys. There are several websites you can go to which gives you some very good practical information on the use of these drugs if you become unwell, as Elena has said. Now, from a pharmacist kind of perspective, there are a few things which I would normally speak to people about, and the main one is timing. And I think if you've watched any of these videos, I'm always talking about timing of medicines. They are fluid tablets. They will make you go to the toilet, and as men we age and our prostates don't become as well as they should be doing, and we want to go to the toilet more frequently. So a lot of the patients I would deal with, the biggest complaint is excessive urination, actually wanting to go to the toilet quite a lot, and it can ruin your life in some ways in terms of and one of the patients actually said to me it was almost as if everywhere they went they were just looking for toilets. So from a practical point of view, if you're going out in the morning time, you don't have to take your fluid tablet first thing in the morning. Go out, enjoy yourself, do your shopping, come back. The only thing I would say is that don't be taking your fluid tablets past roughly about 6 o'clock in the evening. The reason is that there's going to be 4 hours where the drug is going to make you go to the toilet. So avoid those
Might end up on the toilet whole night.
Yeah, you could do. And you also mentioned there about hot weather, and very, very good practical point. If you are going away on holiday, especially to a warm climate, and post-COVID, we're all hoping to have some very good summer holiday, be aware that you can become dehydrated very, very quickly. So make sure that you actually are drinking fluid, but you may also need to cut down the fluid tablet, which is perfectly acceptable to do so. Do speak to your GP about this, but actually giving you some freedom to make some minor adjustments of your fluid tablets could be beneficial.
GP, by the way, is general practitioner. In your country, that could be called, in America, primary care physicians,
yes.
for example. It's a, so again, coming back to my population of the patients, I am obsessed with excessive blood pressure lowering because my patients fall, break their hips, and if you are in your late 80s, broken hip can be the beginning of the end. So you will see my obsession with the blood pressure. Anyhow, you might end up with two blood pressure water medicines. One could be given for fluid retention. The other one can be actually given for blood pressure lowering properties. That's not unusual. I see that quite often. So what is important is to understand your medicines. Whenever you end up on a new medication, please inquire from your doctor or pharmacist exactly what it is. Is it a water medicine? How it works? Because taking two water medicines will put you even at higher risk of various complications. And what we haven't mentioned is affecting the kidneys. So if you're on water medicines, I would expect your doctor to keep an eye on your kidneys and do kidney blood tests, especially at the beginning of the therapy, maybe within a week or two, and then keep an eye on your kidneys on a regular basis, because water medicines, especially if you are taking two of them, will put an extra strain on your kidneys.
Yeah, and I think for any of the healthcare professionals who may be watching these videos, just be aware that when a person comes into hospital and they happen to be on a fluid tablet, just check what dose they're using, because there is flexibility of the dose, as we've mentioned here. So just to confirm exactly what the patient's taking.
And here are our top tips as far as water medicines are concerned. Know the reason why you are on water medicines. Know your blood pressure. Make sure that your blood pressure is not excessively lowered, especially on the days when you are going through a difficult patch with any medical illness, or we are going through a really hot weather period. Most importantly, constipation. Water medicines can dehydrate you and cause constipation, so beware.
And my top tips are to do with weighing yourself. For those people who need to weigh yourself, if you're using it for heart failure, just to make sure that the dose of the fluid tablet is the correct dose. Because if you are retaining fluid or you're losing too much fluid, we can tend to find that out by a change in your body weight. And the last top tip is all about monitoring, to ensure that those of you who are actually using these, that you do get your regular blood test done by your general practitioner. I was going to say GP there, but anyway, okay. And that would be it. So hope you enjoyed this video, and thank you very much for subscribing. Thank you very much. Bye-bye.
Thank you. Bye.